Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now we are looking at the glycogen storage disorders. So glycogen storage disorders. And here the first one we are looking at is the GSD, glycogen storage disorder 0. So this is the deficiency of the enzymes glycogen synthase. Glycogen synthase. And it presents with hypoglycemia as well as the early death. So this presents with hypoglycemia as well as early death. Next, we move on to the GSD1. So GSD1, it is divided into 1A and 1B. So 1A is known as the von Gerke's disease. Von Gerke's disease. So this von Gerke's disease, the enzyme deficiency is of the glycogen 6 phosphatase. Deficiency of glycogen 6 phosphatase. So this was about the glycogen storage disease 1A. And what are the presentations of the von Gerke's disease? So when you look at the presentation, it presents with there is hepatomegaly, hepatosplenomegaly, as well as renomegaly. So hepatomegaly and renomegaly is due to the accumulation of the glycogen. So accumulation of the glycogen, and there can also be the severe fasting hypoglycemia, fasting hypoglycemia. Next, there is growth failure, lactic acidosis. There can be growth failure, lactic acidosis, as well as the hyperuricemia and the hyperlipidemia. Hyperuricemia as well as lipidemia. Next, we move on to the GSD, that is glycogen storage disorders. GSD type 1B. So this 1B, it refers to the endoplasmic reticulum, that is a glucose 6 phosphate transporter. So endoplasmic reticulum and the glucose 6 phosphate transporter. So glucose 6 phosphate transporter. And if you look at the clinical presentation, it is same as that of the von Gerke's disease. That is same as that of 1A. That is, there can be hepatomegaly, there can be renomegaly, there can be the fasting hypoglycemia. There are two hypers, that is hyperuricemia, as well as there is hyperlipidemia. And there can be lactic acidosis as well, growth failure. And another thing to notice, this 1B, there is the recurrent infection due to the impaired neutrophil function. So neutrophil impaired, neutrophil function is impaired, and due to this impairment, there is recurrent infection. Next, what we have is the GSD2. So glycogen storage disorders, this is 2. So under this glycogen storage disorder 2, the disease is the Pompe's disease. So this Pompe's disease, it is the defect in the lysogen, that is lysosomal alpha 1 4 1 6 glucosidase. So it is the lysosomal alpha 1 4 and 1 6 glycosidase. So this is nothing but the acid maltase. So this Pompe's disease, it presents with the weakness of the muscle. So muscle weakness. Then there can be cardiomegaly. And apart from this, there can be presence of death. So the individual, it can lead to death, and this is by 2 years. Within 2 years, can present with death. That is the infantile variant. So we saw the GSD type 1A, 1B, and 2. Now we move on to the GSD type 3. So this GSD type 3 is known as the third letter in the alphabet is C. So it is the Cory's disease. Cory's as well as the Forbes disease or the Forbes disease. So this Cory's or the Forbes, it is nothing but the limit dextrinosis. So the enzyme defect here is the glycogen debranching enzymes. Glycogen, so it is C, D. So D comes after C. So it is the glycogen debranching enzyme. And what are the features of this Cory's disease? So when you look at the Cory's disease, the feature is there is muscle weakness, muscles are weak. There can be the fasting hypoglycemia. So fasting hypoglycemia is present. Next, in case of the Cory's disease, so we saw the muscle weakness of the muscle. There is the fasting hypoglycemia. Next, there is also the hepatomegaly. Hepatomegaly, muscle weakness, fasting hypoglycemia, hepatomegaly is due to the accumulation of the branch chain polysaccharides, and then it also leads to the GR, that is growth retardation, as well as the normal lactate and uric acid levels. So normal levels, this is of the lactate and the uric acid. So we saw the 0, 1, 8, 1b, 2 as Pompe disease, 3 Cory's or Forbes disease. Next we move on to the GSD type 4. The GSD type 4 is known as the Anderson's disease, and this is by the glycogen branching enzymes. So glycogen branching enzyme. Next is what are the features of this? Symptoms is the failure to thrive, the hepatomegaly, as well as the death can be seen within 5 years. So failure to thrive, FTT, and there is the hepatomegaly, as well as there is death. Death can occur by 5 years. So this is in terms of the Anderson's disease. So this was the GSD4. Next, we'll move on to the McArdle's disease. McArdle disease is nothing but the muscle glycogen phosphorylase. So type 5 GSD, McArdle disease. So this is the muscle glycogen phosphorylase, MG phosphorylase, and the features is there is exercise induced cramps. So exercise induced, there is cramps. Next, there is the renal failure due to rhabdomyolysis and the myoglobinuria. So McArdle's, there is a renal disease, that is renal failure can be seen. So this renal failure is due to the rhabdomyolysis and the myoglobinuria. So rhabdomyolysis and the myoglobinuria. Next is there is something known as a second wind phenomenon which can be seen. This is in terms of the McArdle disease. So second wind, two wind phenomenon. Then we move on to the GSD type 6. The GSD type 6 is also known as the Hirsch disease. So it is known as the Hirsch disease. So this Hirsch disease is by the liver glycogen phosphorylase. So it is the liver glycogen phosphorylase, and it is generally benign. There is mild hypoglycemia as well as hepatomegaly. So in Hirsch disease, in McArdle's also, there was a renal failure. Here there is hepatomegaly. So there is hepatomegaly, hypoglycemia, and this is nothing but mild. So hepatomegaly, hypoglycemia, which is mild, and then there is benign as well. Then apart from this, we lastly move on to the seventh disease, the GSD7. GSD7 is known for the Torres disease. The Torres disease. So this is nothing but the muscle fructokinase, MFK. Muscle fructokinase is involved in case of the Torres disease, and this is again this is the exercise induced cramps that are similar to the McArdle disease. So McArdle disease was glycogen phosphorylase. Here it is a muscle fructokinase. So it is the exercise induced muscle cramps. So exercise induced muscle cramp, and there can be the growth retardation, as well as there is the hemolytic anemia. So this was all about the GSD. So to recap just the names, first we saw the GSD0, next the 1A, that is the von Gerke's disease, then we saw the 1B, then the 2, that is the Pompey's disease, then we saw the third was for the Cory's disease or the Fabry's disease. Next we saw the 4, type 4, it was for the Anderson's disease. Next type 5 is the McArdle disease. Then moving on to 6, it was the Hirsch disease. Moving on to 6, it was the Hirsch disease. Then moving on to 7, it was the Torres disease. So this was about the GSD disorders. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.